a medical student, lost her mother 2 years ago, experiencing mild depression. She also has put on a lot of weight in the last 2 years, probably due to depression, and experiencing hair loss, drop in energy levels along with sciatica. What would be the best Medhya Rasayana in this case?
See, we need to assess here. She is a 26-year female. Maybe a triggering factor is there. 2 years ago, she lost her mother and experiencing a depression. But why she is putting on weight, we need to understand that. Whether she has any issues with the thyroid, whether she is suffering from any endocrinal dysfunctions like PCOD or something like that. So that part has to be checked up. Then they observe their hair loss is also there, drop in energy levels, enthusiasm, and of course she is putting on weight. Maybe some strain she might have done. That's a sciatica pain is there. And in this condition, why we need to go for a Medhya Rasayana? Medhya Rasayana should be given just for to tackle her depression. Whenever there is a depression experience, then along with that, counseling is also important. Simultaneously, when you are giving Medhya Rasayana in this case for these depression and all the issues, simultaneously we need to even concentrate on the part of why she is gaining weight, why she is losing her hair, and why there is a sciatic pain. And all these should be separately handled. So it's not only simply by giving Medhya Rasayana everything will go off. No, it is not there. So if sciatica is there, then we may have to go for assessing it, whether it is simple thing, or whether there is any IVDP, or whether there is any disc prolapse or herniation, or maybe due to, or even the simple muscle strain, or maybe we need to assess all these things. Then only we can use a drug. Simply cannot just when a patient comes with some lakshanas, simply you give some medicine to that. It is not the way of handling. This case has to be taken in a very elaborate manner. Then only you think of adding Medhya Rasayana. And she is already putting on weight means, and if you are putting more and more Rasayana Dravyas, be cautious. That may even further worsen the condition. So what type of Medhya Rasayana you will select, that is also very important. You need to select in these type of cases Katurasa Pradhana Dravyas, not should be Madhurasa, like we should not select Ashwagandha, or we should not select Shatavari, we should not select anything like Estimadu here in this case, which may not be supporting. So we need to be very specific and try to analyze first and understand the doshic involvement, then you can go for it.
If the patient has come for some physical ailment, it can be irritable bowel syndrome or gastritis or headache or anything. So apart from that during the process of case taking, if I suspect that there is some amount of stress or some amount of psychiatric points getting involved in the pathology, I would choose a Medhya herb and include it in the prescription, so that, or or counseling, or any of the Medhya methods of treatment would gel well with the physical ailment treatment also, sir.
That can be done. That is the beauty of Ayurveda, and that is the yukti of the physician, treating physician, to select the drug. What kind of drug combination has to be done? Thinking of all Rasaguna Virapaka and the Viruddha concept and all those things keeping in mind, one can select the drug, no issues. For example, if any liver issues is there, and along with that, if you need Medhya Rasayana, then you can go for a Guduchi. Guduchi is both liver protective as well as Medhya Rasayana. And there is a atrophy, something like that. Now you need to give a nutrition nourishing. Then you go for a ashwagandha, estimadu. Both they are midrasana as well as they are promotive, nutritive. Even you can go for tavari. So like that, depending upon the type of tissue involved, the condition is involved. Then along with the midrasana, if you require a brahmana karma enhancing drug, try to select such a drug which has been given all these functions together, and which could capable of handling these issues in a very scientific manner, and which can be done in a conclusively with the single drugs or few drugs only. We could able to assess and address all the issues.
These are all the functions or the benefits that are explained for Shankapushpi. So it is told not only as Medhya, that itself is there. So it is Medhya, Rasayana. Apart from that, it is Kasajit. Apart from that, it is told as Vishahara. It is useful in Apasmara, Unmada. It is told as Chartihara. Also, it is Sara, and it is Vrishya, Smrutipada, Kantida, Balada, Agnida, Kustada, useful in skin diseases and all. So probably if a skin disease with Krumi, with say Anidra, or so in that probably Shankapushpi is useful. So that's why a single herb is explained with many different functions of affecting many different systems. So
No, definitely. We need to understand the basic nature of the drug. That's the reason I told in the beginning. We need to understand the basic nature of the drug, how the drug behaves.